Okay, with a look at some of the latest issues surrounding the pandemic, we're joined live now by Dr. Alon Vaisman, infectious diseases specialist at the University Health Network. Dr. Vaisman, thanks so much for joining us. I hope you had a nice holiday. Let's get into it. We know that case numbers are very difficult to trust for a variety of reasons, but let's focus on hospitalizations and ICU numbers. Is the fact that we're not seeing dramatic spikes an encouraging sign, or is it still too early to tell?
Yeah, every day that we're not seeing a massive spike in the hospitalization and death is always a reassuring feature. And of course, this always takes a bit more time for us to see the full picture. But if you look at the total case counts we have now and the number of cases we have in the hospital, certainly there's been for a while now a large discordance. So there's a big, very clearly an uncoupling between the two numbers that we didn't previously see in the other waves, or to a lesser extent. So every day that we go on is reassuring information about the ICU and deaths for sure.
Okay, and Dr. Vaisman, yesterday, many of the doctors that we see here on CP24 took to Twitter expressing their frustration that the province is allowing 10,000, upwards of 10,000 people at a Raptors game, and yet they are seriously considering closing down schools. The Ford government is making a decision about what to do with in-class learning. Where are you on this issue based on our current pandemic trends? Should kids go back to class after the winter break?
Yeah, it's a very tricky question because the way we approach Omicron, the way we approach COVID might change over the next few weeks or months depending on how we view the disease. Because if it turns out that this disease ends up causing, this Omicron variant causes milder disease than Delta, and we don't see a huge spike in hospitalization and deaths, then there's less justification for closing things down. And when it comes to schools, the way we approach things now, certainly the level of Omicron cases we're seeing now would probably not allow us to open up schools in the first week of January. But again, if we're not seeing the level of morbidity and mortality associated with the disease, then there's less and less justification to keep schools closed. So I think in the near future, that will likely be the approach. But I think very quickly after that, there'll be generally pressure and a change in thinking about COVID, such that schools are going to likely be opened again or very quickly soon after in January, realizing that, as we've seen so far, the trend hasn't been the same as we've seen in previous waves of COVID.
Okay, so Dr. Vaisman, very quickly, do you think that January 3rd kids will be back in class, or is that too hard to speculate?
I think it's pretty unlikely given the number of cases we have. I think if you take the current approach we have with outbreak management and case and contact tracing, then if you open schools up on January 3rd, the number of cases we have is likely to result very quickly in a large number of transmission events between students, between teachers. And we just having a wave that's coming, that's surging at the wrong time. At the very beginning of January, first, second week is probably when we're going to see a spike. So I find that to be probably a big challenge for the province to handle. But again, this may not necessarily last very long. It all depends on how long this wave lasts. And it looks like the wave is going to come and go very quickly.
Yeah, let's hope we get past that peak soon. Okay, and what measures do you think need to be in place to keep schools from becoming super spreader events? You talked a bit about watching the numbers in the future, and hopefully this will be milder, but what can schools do?
Well, many of the things that have already been in place are really the things that are going to save us against Omicron. So now that rapid tests have been more available to parents and students over the last few weeks, that's probably one of the easiest things you could do to try to reduce transmission. And I think it really is incumbent on parents and the school and the system to understand the limitations of rapid tests and how they can be used to try to limit the spread. In Ontario right now, the spread of Omicron is across the board. We're seeing it everywhere. So this kind of approach needs to be taken in many places across the province. And similarly, the PPE and the ventilation have always been a concern in the last few months, and that's going to be the same thing going forward. The biggest problem is going to be, just like we're seeing in hospitals, isn't as much transmission within schools, but children bringing Omicron, bringing COVID into the school. And because the community transmission is so overwhelmingly high right now, it's going to be very hard to avoid that. And so they're going to see tons and tons of cases among students if we do open up within the next week.
Okay. And Dr. Vaisman, the CDC has cut isolation and quarantine timelines from 10 days to 5 based on emerging evidence on when people with COVID-19 are contagious. Some people think that this is more politics than science, but, we'll let that play out. Do we need to follow suit here in Canada with this new CDC guideline? Will this help stabilize our staffing shortages in healthcare and in schools?
Yeah, the approach as to how long a person should be quarantined or should be isolated when they do have COVID, I think it's really a question, first of all, of the science of how likely you are to transmit. And certainly after 5 days, the likelihood does go down, but is certainly not zero. And it's a balance of that and the safety of patients, for example, in the case of healthcare settings. So every hospital is already revising their approach to bringing healthcare workers back. But really, we don't want to push it to the point where we're transmitting COVID in the hospital. We really don't want to bring COVID from the community into the hospital as much as we can. So if a healthcare worker does have COVID, we need to think about carefully each of those scenarios. When is the safest they can come back earliest? And the decision made by the CDC in the United States is a balance of those things. If your society is experiencing extreme shortages at even at essential things like grocery stores, power plants, utilities, you can't have the luxury of having people isolate for 10 days if you're going to have critical shortages in these essential things. So any time a system makes those decisions, whether the CDC or hospitals here in Canada, they're deciding based on a balance of risks and benefits. And hopefully we don't have to get to the point where we shorten the isolation to that extent where we're harming people.
Yeah, we've certainly heard that word a lot. It's definitely a fine balance. Okay, Dr. Alon Vaisman, we really appreciate your time this morning. If I don't see you beforehand, Happy New Year. Take care.
Thank you, you too.